Hi and welcome to my Christmas cranial nerve exam. It's a very special session because I'll be opening up some gifts that contain all the tools I need to perform your cranial nerve exam. And they're definitely all brand new. I have not gone around my office and wrapped everything that I have. And then I'd like to say today's video is sponsored by wrapping paper. Buy a whole roll of it. Cut it up really nicely. Spend a bunch of time wrapping gifts for your loved ones, and then have them open them up on Christmas Day. Feel really terrible about tearing them up. Throw them on the floor. Try to consider keeping them, but then throw them away so that you can do it all again next year. Merry Christmas. The first gift that I've been given is this beautiful gift bag. Let's take a look and see what's inside. What a surprise! My medical gloves. Well, not my medical gloves, medical gloves. These are absolutely perfect. I've been looking for them, for a box just like this. I mean, may as well get ready for my exam. This one work. Good. Does this one work? Fantastic. And now I have this really beautifully wrapped gift. I've never seen such incredible skills. Who could have thought someone could create something so beautiful? So I'm going to go ahead and open this up. How unexpected. An Amazon box. Alright, so let's see what the first thing is in here. Well, that looks pretty cool. What do you suppose it is? How interesting. I believe that this is what I would use during my cranial nerve exam to test if you can tell the difference between pointed and rounded. How about we give it a bash? Why don't you close your eyes, please. Okay. And I'm going to come in. It's not sharp, as in pokey, it's just pointed. And I'm going to be on this side of your face. Alright, do you feel that? Good. And I'm going to do it on the other side. And you feel that? Good. Now, on top of your forehead. Do you feel that? Good. Okay. Now I'm going to just drag it down your face. Slowly. Down. Do they feel the same? Good. Alright. And I'm going to create some shapes. So on this side, I'm going to go 2, 3, 4. Do you know what shape that was? A square, exactly. Okay. And on the other side, 1, 2, 3. Do you know what that one was? A triangle. That is perfect. Alright. So now I'm going to flip around and use the rounded side. We're going to come in and just do that tapping again. Alright, so you can just close your eyes. Do you feel that? Good. And the other side. Does that feel okay? Good. You can feel it. And just along your forehead. Good. Okay. And I'm going to take it down each of your cheeks again. Softly. And did those feel the same? They did. Good. Alright. Okay. So now we are going to alternate between them. And I just want you to tell me if you can feel the difference between each one. Alright? Okay. So can you feel the difference between them? Do you feel how one is a bit sharper than the other, or pointed, and the other is rounder? Good. I'm going to go to the other side. Okay, you feel that? That's fantastic. That is great. What a cool tool. It's almost as though it was mine, but no. Let's see what is next in here. Quite heavy. They are lights. How fun. Let's see if it works. Wow. Well, while I'm here, I may as well use this to perform your sight exam of the cranial nerve. Right. Okay, so I need you to please look at these fingers, my fingers. Great. Okay, and I'm going to bring the light in. Alright, and keep your eyes on my fingers, please. Good. Sorry. Good. Keep your eyes on my fingers. Good job. That is good. Okay. And I want you to please follow the light with your eyes. Good. That's great. And I'm going to go up, follow the light. Just using your eyes, please. Try to keep your head still. Good. All right. Okay. And now I'm going to come in and examine your eye up close. So if you could please keep your eye on my nose. All right. I'm going to just pull your eye down. Look. Good. Keep looking at my nose. Good. Okay, and this eye. Good. Fantastic. Now, if you could look up, please. Okay, and look down. Good. And if you look left and then right for me, please. That is good. Fantastic. Well, that was so fortuitous that was in there. I dropped something, so. Another light. This time, this one is blue. Okay. So, for this portion, I'm going to, as you can see when I turn it on and off, I'm going to need you to please count the number of times. So one time is on and off, on and off. So that's twice. So I'm going to do that for you. And if you could please cover your eye, all right? And then count for me how many times I do it. Okay, are you ready? Good. And how many times was that? Exactly 5. All right, and then we're going to the other eye. We'll close it, and I'm going to get ready. I'm going to light it up. Good. How many was that? 4. Fantastic. All right, and I just need you to please keep your eyes on my fingers. All right, and I'm just going to come in and have a look. Good. All right. And on this side. Good. And finally, if you could just follow the light with your eyes, please. That is such a good job. And the last one, this looks kind of like one that I have. Let's see if it does the same thing. It does. Alright. Well, this is just going to help me look right into the back of your eye. So you'll just need to look right at my nose again, please. And I'm going to quickly come in and pull your eye down. And good. Good, and keep your eyes on my nose, please. And this side. Good. Fantastic. How great. Let's see if there's anything else in this fabulous box of treasures. How fun. Okay, well, we have to give it a test, don't we? I'm going to start out by, just checking that you can hear it on both sides. Okay, you hear it on both sides. Great. Okay, now what I'm going to do is make it vibrate again, so it'll make that noise, and then I'm going to stop it, and I would like you to please let me know when I've stopped it. Okay? Good. I'm going to come on this side, and you can close your eyes, you can keep them open, that's up to you. I typically recommend keeping your eyes closed. Alright, and here we go. Okay, it stopped. Good, yes. Alright, and I'm going to do the other eye again. Good, yes. That's exactly right. And I'm going to do them again. Good, that's good. Fantastic. And the last time on this side. Good. That's great. Okay. Now, I need you to please open your eyes and look at my nose. Okay? And I'm going to bring the sound around again. And I just want you to maintain your eye contact with my nose. Keep your eyes on my nose, please. Thank you. Good. Okay, let my nose still, please. Alright, well, that is so good. I really like what I saw there. How handy. Let's take a look at what else is in here. It's very light. Now what on earth? Okay. So this I'm going to use in two ways for this cranial nerve exam. Alright, so the first, I'm going to blow the air onto your face. Okay? And I just want you to tell me if you can feel it. We'll start out by that, okay? Tell me if you can feel it. You can feel it? Good, and I'm going to the other side. Good, you can feel it, alright? And now I'm going to alternate, and I need you to tell me, please, if they feel the same. Okay? does it feel the same on both sides? Good, good. Okay, if you could please close your eyes. Okay, what I will be doing now is bringing this air up to each of your ears. You can just keep your eyes closed and tell me which ear you hear it blowing inside of, alright? Okay. Which ear was that? Good, alright. You feel it? Good, okay, that's the right ear, that's correct, alright. And I'm going to alternate between each ear. Good. Do you hear that? You feel it feels normal, everything is the same. Alright. And last, I'm going to ask if you could please close your eyes, and I'm going to do soft bursts of air on your eyelids. And I want to make sure you can feel that. Good, that's fantastic. Alright, you can open your eyes. Okay, while we're on the sound, let me make use of these new gloves too. So I'm just again going to make a noise on each side of your head. Good, alright, and I'm going to come on the other side and tell me if you can hear that correctly, please. That's good, alright, you can hear it. Okay, I have a lot of fun with this one, so I hope you enjoy it. But I will be making a similar noise, and then I'm going to, so your eyes will have to be open and you can look at me. I'll be covering my mouth, and because it's the festive season, I'll say some Christmas related words, and I need you to please repeat back to me what the word is. Alright, thank you so much. Okay, and we're going to start on this side. Christmas tree. Christmas tree. Alright, and what was the word? Good. Fantastic. I'm going to go on to the other side. Candy cane. Candy cane. Candy cane. Okay, and the word was? Good, candy cane. Absolutely. Alright, and I'm going to come in again, this time on this side. Father Christmas. Father Christmas. Father Christmas. What was the word there? Yeah, Father Christmas. I know here you say Santa Claus, but growing up I called him Father Christmas, Saint Nick, whatever you will. Right, and onto this side again. Ornament, ornament, ornament. Did you get the word? Ornament, exactly. Okay, now I'm going to make the noise all the way around and continue repeating Christmas words. Reindeer, reindeer, reindeer. Did you get that one? Reindeer, exactly. Fantastic. And again, sleigh, sleigh, sleigh. Sleigh, absolutely. We could do sleigh or we could do Santa sleigh. Both are perfect. Okay, fantastic. I am really so impressed at your hearing. Let's take a look at what else is in the box. How fun! An otoscope. I've definitely never seen this one before. What a great fun colour. Okay. Alright, okay. So I'm going to look into your eyes, okay? If you can just look at my nose, please. Okay, keep your eyes on my nose. Good. And on my nose, please. Alright, I'm just going to come in and pull your eyelids down again. Okay, and look up. And look down. Good, and on the other side, look straight ahead. And look up. And look it down. That is good. Fantastic. If you could please turn your head to the side. I just need to take a look inside your ears. And you don't have any pain in your ears at all? Nothing with your balance? No issues like that? Good. Good. Okay, and you can turn around and let me do the other side, please. Good, your ears are squeaky clean. How fantastic. There's another gift in there. Who could have thought? Now this one I haven't seen before. It's a little reflex hammer. Right, I'm going to, because this is a cranial nerve exam, use this to test your very little small muscle twitches and work. Okay, so if you could close your eyes please, and I'm going to tap this along your forehead. Does it feel the same all the way across your forehead? Good, okay, and I'm going to bring it down your nose. And you can feel that? Good, alright, and on the side of your face, here we go. I can see all your muscles working. Fantastic. Can you feel it? Good. And this side. You feel that? Alright. And then the last one, I'm going to alternate in different locations. And I want you to tell me if they feel the same, please. Alright. right? Okay, I'm going to come in and do it a little bit slower. And it feels all the same. Good, fantastic. Okay, that's great stuff. And well, since we're doing a cranial nerve exam, and I didn't get any of the essential oils that I certainly told the elves to pack. It was on my list, but they just weren't in there. So I'm going to perform the scent part of your cranial nerve exam with some other items. All right. So if you could close your eyes, please. All right. Okay, now take a deep breath. Okay. And another one. And can you identify that scent for me? That's right. It's peppermint. Very delicious. Okay, so you can close your eyes for me again, please. Good. And take a breath. Inhale. And another one. And what is that scent? Coffee. Exactly. Fantastic. I have another one here. Okay, you can close your eyes. Okay. Take a deep breath. And another. Okay, and tell me what scent that is. Holly Jolly Honey Apple Spice. You are unbelievable. That is absolutely correct. That's actually the trick one. People never get that one. They never know that one. Okay. And fantastic. Good. Unfortunately, my box is empty. So I just wanted to follow up because you've come into the cranial nerve exam and make sure that there are no other symptoms or anything that you've been experiencing. I'm just going to take note of any information that you give me. Okay, so any headaches, anything? No, good, alright. Any dizziness? No. Shortness of breath? Okay, sometimes, alright. Good, okay. Do you get any earaches? Fantastic, alright. And do you get blurry vision at all? Nothing, good. Do you battle with your sinuses? No. Good, I mean, clearly you were able to smell those unique scents. It's quite impressive, really. Okay, well, that is fantastic. This was a very unique unboxing for me. I have this strange feeling that I've seen these tools before, but I can't imagine where. But thank you for your time. Thank you so much for coming in, and I hope to see you soon.